Today we are covering stroke, a topic where knowing the priority action can be the difference between a right and wrong answer on the NCLEX. The very first decision point the exam will test is your ability to differentiate between an ischemic and a hemorrhagic stroke. A patient will present with classic symptoms like sudden unilateral weakness, facial droop, or slurred speech. The exam will ask for the nurse's immediate priority. Your answer must always be to prepare the patient for a stat non-contrast head CT. This is non-negotiable because the treatment for an ischemic stroke, which is a clot, is lethal for a hemorrhagic stroke, which is a bleed. Giving a clot buster to a patient with a brain bleed would be a catastrophic error. If the CT scan shows no blood, you're dealing with an ischemic stroke. Now, the focus shifts to thrombolytic therapy with alteplase, also known as TPA. The NCLEX loves to test the strict eligibility criteria for this medication. The most critical factor is time. The medication must be administered within a 3 to 4.5 hour window from the onset of symptoms. The exam will give you a scenario where a patient arrives at 3 p.m. and their symptoms started at noon. You need to recognize they are within that window. However, time isn't the only factor. You must know the contraindications. Common exam traps include a patient who had major surgery within the last 14 days, has a history of any intracranial hemorrhage, or whose blood pressure is currently above 185 systolic or 110 diastolic. Remember this phrase: for TPA, check the BP, not just the history. Even if a patient meets all other criteria, uncontrolled hypertension is an absolute contraindication, and the exam will expect you to hold the medication and notify the provider. Now, let's consider the other path. If the CT scan reveals blood, it's a hemorrhagic stroke. Here, all anticoagulants and thrombolytics are strictly forbidden. The nursing priorities pivot entirely to decreasing intracranial pressure and preventing rebleeding. The exam will test your knowledge of interventions to manage ICP. You should immediately think of elevating the head of the bed to 30 degrees, keeping the patient's head in a neutral, midline position to promote venous drainage from the brain, and initiating seizure precautions. The earliest sign of increasing ICP is a change in the level of consciousness, so any new onset confusion or lethargy is a red flag you must act on. Finally, the NCLEX will test your understanding of post-stroke complications and rehabilitation. Two high-yield areas are dysphagia and unilateral neglect. Every stroke patient needs a swallowing evaluation before they are given any food, drink, or oral medication. This is crucial to prevent aspiration pneumonia. Unilateral neglect, often seen with right hemisphere strokes, is where the patient is unaware of their left side. An exam question might ask about patient teaching or setting up a meal tray. The correct nursing approach is to place objects in their field of vision to promote safety, but to also actively encourage the patient to scan their environment and pay attention to their neglected side to facilitate recovery. This demonstrates an understanding of both immediate safety and long-term rehabilitation goals.